So as I was telling you that basically the excretory function of the kidneys, it excretes waste products and toxins, regulates fluid and electrolyte, and it also plays an important role in the acid-base balance. But in addition, kidneys are also responsible for the production of erythropoietin, which is essential for the red blood cell formation. It controls blood pressure through renal angiotensin aldosterone syndrome via sodium and potassium regulation. It also increases blood flow through prostaglandins and helps in the excretion of sodium in water. And it also helps in the activation of vitamin D, which is the most active form of vitamin D, 1,2,3 dehydroxycholecalciferol. It plays a very important role in calcium metabolism. So basically, the functions of the kidney are excretory functions. It regulates, forms urine, and it activates certain hormones. Now, how hard do the kidneys work? Every cardiac cycle, 25% of the cardiac output goes to the kidney. On the basis of this cardiac output, the normal glomerular filtration rate is 120 ml per minute. We will discuss the glomerular filtration rate subsequently. So if we consider a normal glomerular filtration rate of 120 ml per minute, it produces almost 170 liter of fluid glomerular filtrate per day. But are we passing 170 liter of urine? No, we are not passing 170 liter of urine. We are passing hardly 1.4 to 1.8 liter in 24 hours. So almost 99% of the glomerular filtrate is either reabsorbed, and so there are certain things which are secreted depending on the need of the body. So basically, glomerular filtration, which is GFR of 120 ml per minute, on the basis of GFR, 170 ml of glomerular filtrate is produced per day, but it is reabsorbed. 99% is reabsorbed by tubular reabsorption and tubular secretion. So basically, excretion is the interplay of filtration, which is glomerular filtration, minus reabsorption plus secretions. Secretions are also through the tubules. So very complex way of producing urine. Now, once you have appreciated the basic anatomy and the histology, and the functions of the kidney, now we proceed with the detection of renal diseases. As I said earlier, patients with renal disease may or may not have symptoms. And if they are, even if they are symptomatic, that symptoms are non-specific. For example, a patient with renal disease can come with lethargy. A patient of renal disease can come with loose motions, vomiting. Patient with renal disease can present with itching all over the body. So they can present with non-specific complaints. They may also present as an acute condition in which there is a sudden deterioration of kidney functions, and they can present as a chronic disease, which both acute kidney and chronic kidney injury we will be discussing in a subsequent lecture. They may also present, this is very important, patients with kidney disease can also present with other diseases like diabetes, hypertension, joint pains, skin disorders, cardiac, respiratory, or neurological disorder. For example, a patient of diabetes, he has got no symptoms related to kidney, but his kidney functions are not normal. Similarly, patients of joint pains, like a patient of SLE, they can present to you with non-specific complaints relating to joints, but in reality, their kidneys are affected. So we have to keep a very high index of suspicion. And remember, the high index of suspicion is based on the functions of the kidney, the excretory function, the metabolic function, fluid electrolyte balance, endocrine function, production of erythropoietin, the blood pressure regulation, etc. So you have to keep in mind all these functions of the kidney when you are detecting a renal disease. Now, whenever a patient comes to you with the renal disease or is referred to you because of renal conditions or because of his labs, we have to identify first that is there a kidney disease, renal disease, and if the disease is present, where it is. Is it pre-renal? intrarenal or postrenal. Prerenal means disease which is not affecting the kidney per se, but because of the complications of that disease, kidneys are affected. For example, a patient may come to you with loose motions and vomiting and severely dehydrated. So as such, there is no fault in the kidney, but because of dehydration and hypovolemia, his kidneys are affected. Or he can present with intrarenal disease. For example, patients of nephrotic syndrome, they present to you with edema all over the body. And here, the major pathology is in the kidney itself. That is, the glomerular filtration rate is affected. Similarly,